So the Functional Coronary Angiography initiative builds on work we've been doing for more than 30 years and extends the typical coronary angiography, which looks at the anatomy of heart arteries, primarily looking for narrowings within the vessels, to look at the behaviour of arteries and see if they are prone to spasm either of large vessels or small vessels. And as opposed to a normal angiogram technique, this requires provocation of those abnormalities. In normal people, those abnormalities do not occur, but in people who have chest pain syndromes caused by these abnormalities, we can demonstrate that with the patient on the table. They get their typical pain, changes in their cardiograph, and we can see their coronary arteries virtually disappear due to spasm.
What the test involves is doing a coronary angiogram, which is putting a tube into the patient's heart through their arm, and then injecting drugs to try and bring on the spasm in the big arteries, as well as looking at the blood flow in the microscopic arteries.
So at the moment, functional angiography is not a routine procedure. So what we're trying to do is make sure that these are conducted as part of a standard of care for patients who have a normal angiogram to really embed it as a standard practice in cardiology.
One of the things I enjoy about doing medicine and looking after these patients is the relief on their face that the chest pains that they've been experiencing for a long time, and they thought that it might have been all in their mind, you actually have got an explanation for it. You have treatment for it.